I think we still have some folks trickling in, but I want to thank you and welcome you again to the Denver Marijuana Management Symposium. We're thrilled to have you here today. My name is Joey Pena. I am the Cannabis Process Navigator for Denver's Department of Excise and Licenses. So in my role, I identify ways that we can strengthen our city's partnership with marijuana businesses, and I develop strategies to improve and help our marijuana business owners navigate the city's application and inspection processes. I think I'm really fortunate to work with city leaders and team members that really strive to do good, value-adding work every day. And I'm thrilled today to have our panelists here to talk about how we can align and create harmony between medical and adult use marijuana programs. Through this conversation that we're going to have, I hope you leave with information or with strategies that really help you do that kind of good value-adding work back home. So with that said, I am going to kick off with our panelists. I'm going to have them do a brief introduction before we jump into our dialogue. So we're going to start with Kat Packer.
All right. My name is Kat Packer. I'm the Executive Director and General Manager of the Department of Cannabis Regulation for the City of Los Angeles. The City of Los Angeles has a population of about 4 million, so population size is about the same size as the state of Colorado. And again, our specific responsibility and authority is to advise and administer the city's cannabis programs.
Hi, good afternoon. My name is Sean Collins. I'm the Executive Director of the Massachusetts Cannabis Control Commission. In that role, I report to 5 commissioners that oversee an independent state agency, so we don't report to any, we don't report to the governor or any other constitutional officer. We also oversee both the adult use and medical programs. Adult use was the purpose of our creation originally. However, the statute that ultimately passed requires to transfer previous jurisdiction from the Department of Public Health over to the Cannabis Control Commission. So in that role, I oversee both programs.
Hi, everybody. My name is Eric Gunderson. I'm the director of Maine's newest state agency, Office of Marijuana Policy, which was established in February this year by our new administration, the Mills administration. And it's home to both of our programs, our adult use program, our very soon to be adult use program, and our current medical program, which has been in operations for about 10 years. And much like Massachusetts, it sounds, the impending adult use program was really the driver for the agency's creation. And then kind of jumping into the conversation about aligning the two programs at the very end of a legislative rewrite of the Maine's Marijuana Legalization Act, they actually had moved the medical program from the Department of Health and Human Services over to the department that is now home to the Office of Marijuana Policy to start that harmonization. So I have a little bit of a different perspective than Kat and Sean, as we're about to implement, and we've started making plans and tinkering with harmonization and really starting to develop the long-term plan, and these two have lived it and been through it, but I hope there's some value in my perspective and what we got going on in Maine.
Yeah, I think there's a tremendous amount of value here, and I thank you so much for offering your time and your expertise today. So I want to kick us off and question for Eric and Sean. So there's statutory language that requires your agencies to align your state's medical and adult use marijuana programs. Is that directive helpful? And are there ways that you'd like that statutory language to be more or less explicit? I think another way to think about that is what kinds of challenges or advantage does that statutory language introduce in aligning those programs?
So I haven't talked about this with Sean, but for me, as a regulator of these two programs, I love it, right? Any clear directive that I can get that comes from the legislature that's not being driven by my office, the regulator of the two programs, the better, right? And there are a few benefits in there. The work of coordinating these two programs is so important for a bunch of different reasons, and we're going to get into those reasons, I'm sure, in the next hour. But the fact that it's so important to develop a good faith partnership with both programs in order to coordinate the two and make the changes needed, that it's good to get some type of political coverage, because whatever those changes may be, are more or less probably not going to be that popular. And I would dare say 9 out of 10 times when you go to harmonize the two programs and align them, changes are going to come on the medical side for a bunch of different reasons. So there's also the fine line you have to walk there too, because you don't want too much information and too much, you don't want the legislature digging too deep and putting too much on you. You definitely want some flexibility there to write your own rules and regs to be able to properly operationalize what they direct you to do. But that's just a long way of saying that, at least from Maine's perspective, the statutory language that's there now that directs us to harmonize the two has been helpful and beneficial, and will continue to be so. And then also, I'll just add real quickly, if there's people in the room right now that have a medical program and see an adult use program on the horizon, a nice little piece that the legislature put in our Marijuana Legalization Act was they created this legislative commission to really take a step back and take a look at the two programs more from a 30,000-foot view, almost like a third-party auditor. As you're the regulator and you're in it and living it every day, it's nice to have a fresh perspective. So their main directive is get together annually, look at the two programs, present recommendations to the legislature on how to change the two programs to bring them more into a line, which makes our lives as regulators a little bit easier on their operational side and making sure that our programs are functioning correctly. And the one caveat there is I probably wouldn't feel that same way if I wasn't actually on the commission, because I don't know the best way to say this, but lawmakers have a tendency to spiral out of control sometimes. So if you can kind of keep the conversation on the straight and narrow and make sure that it's heading down the track that you, as the regulator, know is the right direction it needs to be going in, I think that's a tool that that will be beneficial to not only Maine, but hopefully for the other states that are moving in that direction.
Sean?
So I think a lot like Eric, I do agree there's definitely value to having a legislative directive to merge the two programs. Where I think Mass was a little bit different was we as an agency, as the Cannabis Control Commission, we operate a lot like a startup. We were a brand new agency. I was appointed in November of 2017. And if anyone has heard this speech before from me, I'm sorry, but we didn't have any desks. There was no phone number. We had nothing. There was no infrastructure. So we also, at the time of being a startup, we're also now statutorily tasked with a merger of an acquisition of a program that had been in Massachusetts since 2012. And so there's a legacy program there so the opportunity presented to us is we can make some changes, but at the same time, I don't know how to do it any better. And I think that's the challenge of just because I can't answer the question of what I would do differently doesn't mean you're doing it the right way either. So the opportunity was to really bring the two programs together, but the challenge was it didn't leave us a lot of flexibility to make any wholesale changes. So I described our transfer of the medical program as a lift and shift. We can make changes around the edges, but I also didn't have a chance to really talk to the staff that also transferred over. There's about 22 people that didn't work for me that now do, and we transferred on Christmas Eve, so kudos to those guys for showing up to work on Christmas Eve and having a new boss. And there's really awkwardness to that around the personnel and the people element of it. But we also inherited a program that it didn't have our fingerprints on it just yet. And we're in the middle now of trying to make those incremental changes. Another key distinction between our two programs is our medical program is vertically integrated. That's a challenge as far as the marketplace, where our adult use program is more of a supply chain. And so again, we're trying to fit those two things together. And that's where I think additional harmonization is still required. But just having that directive, and also there's obvious operational and administrative efficiencies around it. We're regulating a plant, and once you pop seeds or have clones or anything like that, it's a plant. Its destination is not, or its fate is not yet determined. So having two regulatory schemes oversee that same exact plant would be incredibly awkward. And I think that's where the value of that directive is good, but it didn't give us a large opportunity to make any sort of policy choices with that independence. And I think that's the important part of our statute is the commissioners that I work for are totally independent. So we don't roll up to the rest of state government. And I think that was a challenge that we're still kind of sifting through now, but I would do it again in a heartbeat.
I have a follow-up question on that for you, Sean. So you suddenly have a team of about 22 people.
Sure.
That you have to, that are now going to report to you. How do you get them on board? How do you get them ready to do that work? Where do you start? Where's the first place that you start?
I think, so I'm going to choose my words carefully. I don't know what I don't know. And I think that was the important part of just sitting down with the staff in that program and saying, if you could start from scratch, what would you do differently? If you were the boss for the day, what would you do? And I think starting with that level of, respect of, I don't oversee this program. I don't know why you made the choices you previously made. Help me. And also that allows, I think that gets folks to have a stake ultimately in the way things turn out. It gives them a stake in in their job and their role and saying, my opinion matters here. So those 22 people on Christmas Eve got to have a meeting with me and tell me everything. I got such a download at that point of these operators. This is how we choose to do things. This is how we conduct our inspections of facilities. This is how we process our patient registrations. All those things were tidbits that I didn't have any luxury of knowing prior, and so I admitted that. I think that first step of just saying, look, I don't know what I don't know, so please help, just helped us, I think, break down those kind of boss employee barriers, but also let them know that I was invested in what they were doing previously and didn't have a different angle or approach that would undermine all the work that they had put in to build, I think, by all accounts, a pretty successful program.
So they have a real stake or investment in developing kind of the vision and the values going forward.
For sure. Yeah.
Excellent. I'm going to jump around a little bit here, Kat. And Eric, I'm going to come back to you on a question. But Kat, so the Los Angeles Department of Cannabis Regulation, in our conversations before our panel today, you mentioned that you've spent 2018 and the better part of 2019 working to transition existing medical marijuana operators to the state's new legal adult use market. Why has that been a challenge? And what should other state and city agencies know about the process?
Yeah, I think one of the realities is that the city of Los Angeles just wasn't prepared for legalization. Proposition 64 happened in 2016. And it just seemed as though the city of Los Angeles wasn't quite aware of the gold mine that it was sitting on. And I did not inherit a program, stepped into this role in August of 2017 before the regulations had even been passed. So I didn't quite know what I was signing myself up for. But the reality is that part of the true difficulty that we had in transitioning was that there was no Department of Cannabis Regulation. When the department was first created, we were allocated 5 positions. I was appointed, and it took me about 6 or 7 months to get 4 additional staff members. And the city of Los Angeles did not pass its cannabis ordinances until the 3rd week of December in 2017. And oh, by the way, adult use sales were going to start on January 1st. And so I had a team of about 4 people that were supposed to be responsible for 4 million people and transitioning operators who had never been regulated before. And this industry had relatively good reason to be concerned about what some of those next steps were. And we were just in a very, very tough position at the start of 2018 because, again, the state of California was going to start adult use sales on January 1st. We were still in the process of building a website overnight and, trying to make sure that we had computers and phones and just very basic infrastructure in place. And nevertheless, my team, who's amazing and has grown over time, was able to begin to accept applications on January 3rd. And oh, by the way, on January 4th, former Attorney General Jeff Sessions rescinded the Cole memo. And so you can imagine that early 2018 was just not a very fun time for me personally. But once we started to just put basic infrastructure in place, the reality is that we had to authorize medical operators and operations for the first time. The city of Los Angeles had expressly prohibited all medical operators, but gave them what they were calling limited immunity from prosecution. And this concept of limited immunity was really premised around this concern of federal prosecution, and we don't want to be formally authorizing businesses to engage in illegal activity, so we're not going to give them authorization, we're just going to give them limited immunity. But the state of California on January 1st didn't allow for operators to have limited immunity to be authorized. It required them to have formal authorization from the local jurisdiction. And so I had to have a press conference with about 20 different media outlets on January 1st, and I had to announce to the city that the city of Los Angeles would not be participating in adult use sales on January 1, and it took us several months before we were able to kind of wholesale get some of these businesses operational, and the sky didn't fall. But the reality is that we just did not have the infrastructure in place to transition transition those operators probably were only required to do two things for the last 10 years: pay their taxes, and then some owners were required to do background checks. That was the form of the City of Los Angeles regulating cannabis prior to the establishment of the department. We are now a department of 26. We have a total of 37 positions allocated. It has taken a very long time for us to get to this point, but I think the reality is that if I had an opportunity to do it again, and I don't think that this option would have been politically viable, would have been to say, we need to suspend all activity for 4 to 6 months, and maybe even longer, just so we had an opportunity to get our operations together. Most people design the process and then begin implementation. We had to begin implementation and then design the process.
So I'm interested on that to know, are there ways, aside from having phones and computers, are there ways you could have been, that the city could have been better prepared, or that they could have started implementing that infrastructure that would have made that a less painful process, or maybe an easier process to transition through?
Yeah, I mean, and I try to be as completely transparent with folks, because it doesn't make sense for me to give folks these sterilized answers. But the reality is that no one in the city of Los Angeles wanted to touch cannabis. And that's part of the reason why a Department of Cannabis Regulation was created. There was real concern about federal enforcement. I wasn't so concerned and signed up. But the reality is that it would have been helpful to have been loaned staff, for someone to say, you from building and safety, you from the police department, you from the fire department, policy folks borrowed from some council offices, you are going to be assigned to the Department of Cannabis Regulation. You all are going to be tasked with getting this off the ground. Instead, a new agency was created, and we had to start from zero.
Can I actually jump in on that?
Yeah, please do.
Because Kat makes a great point as far as the obviously the political risk of suspending operations you've got to overcome that political calculation. But to her point, as far as having resources and having existing staff, when the ballot question was pending in Massachusetts, and our adult use law really stems from a ballot question, there were not a lot of folks that thought it was going to pass, and there were a lot of folks that were actively campaigning to hope or to move the ballot question so that it would not pass. And so as a result, formally, kind of, it seemed like state government was saying, it's not going to happen, we'll make sure it doesn't happen. And so there weren't a lot of people, and myself included, I really got embarked on this journey myself by being in a position within the agency. So originally the ballot question would have put it within the state treasurer's office, and I worked there at the time, and I said, we at least have to be prepared in the event that it does pass, because the burden falls to us in our agency and our bureaucracy. And so I pulled in our HR department, I pulled in our legal department, our IT department, and I said, we've at least got a plan. And so because I was the one, I guess, willing to Google marijuana at work, I ended up in the position I'm at now. But it's also because in that process of trying to learn as much as I could, I came to the folks in Denver. I met with Ashley and the folks in your office, and you could not have been more generous with your time, because I think a lot of bureaucracy was, after living through it in that iteration, kind of cannabis or adult use 1.0, we're more than happy to share those kind of lived experiences. But that infrastructure did not exist in Massachusetts. But we also, in our statute, had incredibly tight timeframes. I was appointed in November of 2017. Our regulations had to be promulgated by March of 2018, which meant that I had to have a draft available for the public by December of 2017. That's a huge task, and I didn't have a general counsel. I didn't have IT. So to Kat's point, what do you spend your time doing? Do you spend your time hiring the staff that you need, or do you spend the time doing the work that needs to get done? You can't do both. And I think that calculus was not something that a lot of folks considered. So if you have not embarked on this journey yet, give that some thought as far as your timelines. And also, Kat made a point earlier in her earlier presentation around being honest with timeframes. So I think it was in the context of social equity by saying, we can't realistically get to this for, let's say, a calendar year. That's a really hard discussion to have with people that have been waiting for generations for this to be legalized and actually re-legalized. But being honest with people, I think, is the way to get credibility, especially when it comes to a new burgeoning industry. So sorry to jump in on that.
No. It's extremely helpful. Eric, I'm gonna come back on. So in our conversations, leading up to the panel today, you told me that harmonizing medical and adult use programs is more efficient from an operations perspective. So tell me more about how state and local agencies can be more efficient by aligning their programs, and share examples, if you will.
Yeah, no, and I can, more from my perspective at the Office of Marijuana Policy, I mean, a lot of states have set up their regulatory structures differently. I know a lot of states have shared maybe the burden across different state agencies, multiple state agencies. But in Maine, for whatever reason, they decided to basically centralize everything into the Office of Marijuana Policy. We're in charge of licensing, compliance, enforcement, policy development, and legal. Our data, our communications, all of our stakeholder engagement is all centralized within my office. So it's so important because you want to have a successful program for the administration you work for in the state that you live in to have effective and efficient operations to make sure that both programs are running smoothly and are heading down the track the way you want them to head. So with that, it's so important to have harmonization between the two programs, because we're starting to see, we're currently heading in that direction, but right now there's a huge void in where Maine is. So just a little bit of history, the medical program has been in operation in Maine for about a decade now. And over those 10 years, very little oversight, very little resources. People didn't pay much attention to it, and it just kind of became its own thing. People like to call it the Wild Wild West. I mean, I don't really care for that term, but that's essentially what it was. And now, in 2016, the voters may come along and say, hey, adult use, we want that. And that's a much more structured tax and regulate industry. I mean, it's oil and water. And when you're trying to run both programs under one umbrella department or state agency, one licensing division for both programs, one compliance division for both programs, it becomes very difficult. So some basic examples of stuff that we're putting into our long-term plan on how to bring them more in line with each other just from an operational standpoint. Our medical program operates off a plant count, and our adult use operates off a canopy. Some basic beginner level stuff. The process for background checks, when you're going through the licensing process, there's completely different. On the medical registrant, comes directly to my office, pays us. We have to go to SBI, the State Bureau of Identity, get everything processed. On the adult use side, there's a whole different process to have it done. And then Sean's talked a lot about vertical integration. So we allow it. It's a little bit different. On the adult use side, you can be vertically integrated, essentially, as long as you hold those different licensing types. So you need to hold a cultivation license, a manufacturing license, and a retail license. Now, on the medical side, if I'm a registered caregiver, which we have 2,500 of, you can be vertically integrated, but as long as you're a registered caregiver, you have all those authorities. You're allowed to do all that stuff, which presents a number of challenges from an operational standpoint. The licensing process and compliance being one, those tough conversations that you have to have with your bosses about what's actually happening, what little information that you have, collecting data to make informed decisions within that program, tough conversations with municipalities about not being able to give them straight answers about exactly what's happening within their municipality under the purview of your program. So there's a lot of different things that we have in our long-term plan to help bring them together to make sure that both programs are successful, the administration is successful, and the impact of both programs is minimal on the state. And that's not to say that we didn't do some good things. When the legislature finished revising the Legalization Act, they did make some changes to the medical program. They now need to be on the same track and trace that the adult use program it is. They now need a local authorization in order to open up a medical storefront, which wasn't there before. But I will say a piece of advice as you're starting to go down this road would be to start early. So when I showed up in February 4th of this year, it was basically me sitting alone in a room. And when Sean says he inherited 22 people, that makes me jealous. I inherited 4 people, 2 office staff and 2 field investigators for 2,500 caregivers and 8 dispensaries. So think about that for a little bit. But I would say start early. So in every single conversation that I had early on, whether it be with municipalities, within different state agencies, with the staff that I inherited, I started a list of things that made sense in order to get the 2 programs to where they needed to be. And luckily, a few months down, I hired a director of policy, and I said, here's my list. Handed it off to her, and she's done a great job with it, but it's a thing in my office. When we come across them, we say, add it to the list, add it to the list, add it to the list. And it's developed into a fairly significant list, and we're making plans to execute that plan.
So there's some great stuff so far that I'm hearing around, just in each of your answers, I think, around stakeholder engagement. And so I want to, this question is for Sean, but everyone feel free to jump in here. What stakeholders should be involved in these conversations about harmonizing medical and adult use marijuana programs? And I'd like you to think about whether there's a particular stakeholder that you wish that you would have engaged sooner.
I think the list would be smaller if the question was, what stakeholders shouldn't you engage? I mean, I think at this point, I can't think of anyone that we wouldn't want to talk to, wouldn't be curious about what we're doing, and it really runs the gamut. I think, first off, in the context of a medical program, patients first and foremost, providers, clinicians first and foremost. We in Massachusetts authorize docs, physicians, certified nurse practitioners, and physician assistants to all certify patients for the program. That, I think, in the context of a medical program, that's your that's your constituency in a way. Obviously, your licensees as well. But we're in Massachusetts a pretty strong local control jurisdiction as well, and so getting local governments, mayors, city councils, building departments, police departments, fire departments, you name it. I'm more than happy to drag in any state agency that I possibly can, because there's an expertise there. So as I mentioned earlier, we transferred jurisdiction for the medical program from our Department of Public Health. When we're talking about a clinical setting, we're talking about patient access. Who better to have at the table, though, than your Department of Public Health? We also talked with our Attorney General's office, our Department of Agricultural Resources, around pesticide use. And one of the first times I came back from Denver after one of my first meetings out here, and I said, pesticides is now in my mind. I met with our Department of Agricultural Resources, and they said, well, first and foremost, let me start by saying we have exclusive jurisdiction over pesticides. And I said, great, I'm done. That's your problem. It's on their list now, not mine. But those are constituencies that I think we can't take for granted, because those are folks who are going to come in at the 11th hour with questions and say, well, why didn't you consider this? And so one of the things that I think our legislature did, and it was smart, I have the privilege of chairing this group. It's a 25-person cannabis advisory board. It's a bit unwieldy in its size, of course. It's also got 15 appointments, 5 each from the governor, the attorney general, and the treasurer, plus some ex officio members that include the Mass Municipal Association, so the Coalition of Cities and Towns, the Commissioner of the Department of Revenue, the Commissioner of Public Health, the Commissioner of the Department of Agricultural Resources, representatives of the Mass Chiefs of Police Association, someone from the State Police. So it is a kind of an alphabet soup of constituencies, but it's a public body. So we meet in public, and again, I get the privilege of chairing it, but someone mentioned earlier in one of the panels about having folks together in a room and across the table from each other to raise counterpoints. I think it was Andrew Brisbane that mentioned it, where the chiefs of police around issues like delivery and social consumption are going to have their concerns, but folks that from the industry that are looking for these new license types, having them at the same table and forcing them to have a conversation and giving them literally the table to do it at, I think is a really valuable move. And also requiring it to be done in public means, one, they're going to behave, hopefully, but also that now the public has access to this information too, and it allows us as somewhat regulators and policymakers, I think, to make more informed and complete decisions, but also forces them to be at that table. And if they don't show up, that's their prerogative. But we gave them the table to do that. So I think the stakeholder piece is something you can't discount, and drag as many people as you can to the table and have those conversations, and also just be prepared for, not everybody is going to be at the same kind of policy acumen as some of us that are kind of living this stuff day in and day out. They're going to ask questions, I think, are just going to force us to think a bit more broadly about some of the issues we have to confront. But stakeholder engagement is one of the key takeaways I got from the states that came before us.
And Kat, can I ask you, just from the perspective of being in a jurisdiction in a large city, how did you participate, or how did you engage with the state through stakeholder engagement? Is there anyone that you wished that the state would have talked to sooner, or is there anyone that in your processes you wish that you would have engaged?
I think that over time, our engagement or other folks' engagement has increased. The reality is that we all had our responsibilities and mandates on or before January 1st, and as it was mentioned previously, we're juggling these responsibilities and trying to figure out if we're designing, if we're doing the work, if we're taking time to communicate and engage. And what I can say is that I think Lori Ajax did an excellent job at, one, creating the infrastructure and space for us to have open dialogue with the state. But there are hundreds of cities and counties in California. I think that us being the largest city in the state of California allowed me to have direct access, and if I needed to call her, I could. And of course, that helps with things going on. But I think that the reality is that you want to try and engage folks as early as possible, but there needs to be, and maybe some folks' processes are different, but most of the time people are trying to engage to get to a particular result. People who are engaged in this process need to know who are the result makers. And the reality is that by and large, it's not the Department of Cannabis Regulation in the City of Los Angeles that is the result maker. It has been our City Council that has been leading policy development. And so while I encourage and continue to receive feedback directly from stakeholders, part of what I spent, again, because we didn't have a public information director, I was serving as the public information director for the city, or for the department, was really trying to engage directly with stakeholders and letting them know who the decision makers were in the process, so that every single time there was an issue, people weren't immediately running and screaming at me, but they had an understanding of, folks are upset about budget as it relates to the social equity program. These are your members of the Budget and Finance Committee. If folks are concerned about policy being made, this is the Rules and Government Committee. And I think that just allowing folks to know who is it that's making those decisions was advantageous for us early on, just trying to direct those folks to folks who could actually actualize whatever result they were seeking.
I'm curious how, so I think the how is really interesting to me. So you mentioned that Lori did a really great job of engaging. What did that look like? I know that in Pennsylvania, the state government has done listening tours as they're looking at adult use. They've done, I think, what is fairly an extensive listening tour where they've stopped in communities and had public forums so that people could talk to them. What did it look like in California with Lori? And then when you're also directing folks on who to talk to at the local level, how do you do that in a way that doesn't seem like you're deflecting questions, but that you're trying to have a more productive dialogue?
Mm-hmm. Yeah, and I think the reality is that we're the Department of Cannabis Regulation, and if it's a cannabis-related issue, it's going to get brought to our desk. We get questions about enforcement all the time. We have no specific enforcement authority against unlicensed facilities. We get health-related questions all the time. We are not public health professionals at the Department of Cannabis Regulation. So part of it is, one, us identifying who is a part of that conversation and being able to connect folks directly. The state of California's the state-level engagement has involved a number of different components. The state of California has a cannabis advisory committee, and so they meet regularly and travel around the state to tackle. They have different committees and to address different issues. And then also, the state of California in 2018 went through 3 separate emergency rulemaking processes. And so every couple of months, the entire infrastructure that we were working on shifted and changed, but there was a lot of public comment and engagement with those particular rulemaking processes. And just recently, part of what I was able to do was to send staff to Sacramento to essentially walk around BCC's office and look at all their checklists, look at all their desk manuals, understand how they run their operations, essentially have points of contacts and liaisons in every single office in the state. Because if there's and again, we're the city of Los Angeles, so I expect this type of service. But the reality is that there's an issue that's going to impact the Los Angeles market. You better believe it's going to impact the California market. That's how big we are in this space. And so if there's an emergency that's on my desk, it's in Lori's best interest to know about it immediately, because then the governor's going to be asking about it.
Yeah, go ahead.
Oh, I
Eric,
just wanted
please,
to add, I don't have much to add to what Kat and Sean said, but it is an experience that I went through in Maine that I think would bring value to this conversation. So I agree. Involve as many stakeholders as you can early on. One of the challenges that we ran into, which was actually surprising to me, was the internal stakeholders, our different state agencies. And that might be specific to Maine in kind of our history, but it might not be. So a lot of the staff of the state agencies lived through the prior administration where for more or less you weren't allowed to talk, speak, breathe anything marijuana. So when my office was created, and like Sean, we were under a tight timeline. We needed to get our regs to the legislature before we went home. We needed to involve as many people and as many internal stakeholders as possible. Department of Agriculture, Public Safety, Health and Human Services, all the same ones. So when I would email to try to set up meetings to get them involved in the process, I wasn't getting a lot of responses. And the very first response I got back was, "Am I allowed to meet with you about this?" And I was shocked. I couldn't believe it. So we obviously made accommodations to have our boss, the governor, kind of send out a message saying, "Hey, we're here, we're doing this, let's do this smart. Yes, meet with the Office of Marijuana Policy." So in case anybody runs into that issue, it's good to have a little bit of support and directive from above you, wherever that is.
And I certainly appreciate this talking about engaging our internal stakeholders. That's critically important to the success of these programs. External stakeholders as well, specifically I think marijuana businesses. We were chatting just out in the foyer about, I was in Michigan on Election Day 2018 when when voters approved adult use marijuana, and throughout the day I was visiting with some medical caregivers, and it was split about 50-50 of folks who sold and were actively using marijuana and were not in support of adult use marijuana. Those external stakeholders, marijuana businesses specifically, I think they're an important component of this kind of engagement. So I'd love to know from the three of you how, through either formal work groups, informal roundtable discussions, calls for written comments, what were your most effective tools for soliciting industry feedback and making sure that you were hearing those marijuana businesses? Eric, if you don't mind.
No, not at all. And this might actually, the second part of my answer might get into a question that's coming. But the first thing, when we were developing our rules and regs for both programs and how we're going to move forward as a state, all the states go through some type of administrative process with their rulemaking and reg development, where they need to go out to public comment. So what we did to involve and get as much feedback as possible from the industry, because a lot of times what they have to say makes a lot of sense, we did multiple, we pushed our developing rules out in a public forum, and we asked for their feedback, and we did it in a completely transparent way. So just for an example, when we were going through our adult use rules and regs, before we got into the actual MAPA process, we published them, we asked for their feedback, and after we had finished compiling it, we put it all back online for everybody to see. Basically, who submitted this comment, what organization they're with, what their comment is, what specific section of the rules and the regs they're addressing in our decisions that we landed on, whether we were going to accept it, we were going to accept it in part, or if we were going to deny it, and if we denied it, a reason why. And that was actually a little bit easier because 9 out of 10 times it was basically statutory changes needed. But I can't even explain to you the feedback we got on that process. Everybody was just floored with the fact that we took that extra step to get their feedback, and then we would put the revised draft out. And I would have people calling me or calling the office so surprised that I can't believe we submitted 6 comments and you accepted 2 of them. That's incredible. It blew their mind, but it made sense from our perspective and their perspective. So when people say listen to the external stakeholders, not just listen, but listen and be sincere when you listen. That is one, and I'm actually forgetting the second one, so I'll pass it on and jump back in.
And just a follow-up question for you and Kat, I think. So you mentioned a state commission, Kat. You mentioned also like a cannabis advisory committee in the state. How is industry reflected in either the commission or the committee? Are they, or is that made up of kind of policymakers? Just curious for the both of you.
We have a state cannabis advisory committee, and it does have industry representatives, public health professionals, law enforcement, et cetera. We have a cannabis regulation commission that happens on the local level, and there aren't any industry-specific representatives on that commission. That commission has a dual responsibility. They can make recommendations to the city council and the mayor on cannabis-related issues, and they also participate in the actual licensing process, specifically for retail facilities. I do think that the commission has been, at least in my opinion, a more effective vehicle for local community members to share information. I think that the challenge, again, though, is that the reality is that there are specific decision makers, and so even if people go and share that information with the commission, the limitations of the commission is that the commission can just share that information with the decision maker. And from experience, I've seen policy be able to change much more quickly when stakeholders are engaging directly with the decision makers.
So in the state's Cannabis Advisory Board that I chair, there are industry representatives included within it. And that's obviously a value add in the discussion purposes. But I think one of the things that we struggle with is trying to put the industry in a box as well. Who is the industry? And I think that's one of the challenges, especially as we had an existing medical program that were largely, they were vertically integrated large operators. And so when they come in representing to be the industry, we've got to sift through some of those comments as well. So when they're saying, you should have access to capital of at least $1 million. Well, okay, what's the rationale behind that? That way we can freeze out the marketplace. Well, that's not really a good public policy objective, and we have pretty strict social equity goals in our statute. So one of the things of not just taking someone's word for it, but also making yourself available, to Kat's point as well, and to Eric's, as far as just being available to figure out, let the industry come to you, but they won't come to you unless you're available to them. So before we even embarked on our regulatory drafting process, after I was first appointed as the executive director, we went on this statewide, the commissioners went on this statewide tour to just listen. And it was that kind of availability to say, what do you want to see in regulations? And we heard a lot. We want small farmers to have access to this marketplace. Our regulations now allow for a craft cooperative of up to 5 cooperative members. Important in this context to keep in mind, this is Massachusetts. We have pretty harsh winters and pretty late springs. But still, it's a theme that is now embedded within our regulations. Make room for small operators. We have a micro business license that authorizes up to 5,000 square feet of canopy plus the equivalent of 2,000 pounds of production. Those are things that are direct results of that listening exercise. Barriers to entry. We have incredibly low fees to just apply to us, and incredibly low license fees to get a license as compared to our previously or pre-existing medical marketplace. So the listening piece for us, I think the difficulty is who actually is the industry and how do they represent themselves to you to make sure that you're able to kind of, everyone's going to have an angle. I think that's a guarantee. But what are they trying to tell you? And being able to decipher sometimes and make sure that you can say, okay, there's something behind this request that we just need to scrutinize a bit. And to be clear, I think they've also been an incredible partner because everyone wants to see this industry succeed because at the end of the day, a burgeoning new industry does represent the opportunity for generational wealth. That's why the social equity component is really important. But it's also a new industry that I think has job effects, economic development effects for the Commonwealth too. So I think our difficulty is really just trying to harness and answer and decipher some of those questions.
And Erica, so kind of a follow-up to some of this is you had mentioned earlier that medical marijuana programs generally, and in some cases, they're more loosely regulated. And so tell me a little bit more about the challenges of getting medical marijuana operators to come into compliance when an adult use program is introduced. How can other cities and states navigate those challenges?
Yeah, and that was most certainly the case when I took over the program. I think the number one challenge Well, listen, when you go through this process, I think the best approach is to be upfront and honest with them. Changes are coming. Don't sugarcoat it. Let them know. But again, speaking to what we've been speaking about this whole time, make yourself available to them and work with them during this transition. But I think the main challenge, which I'm sure is not specific to Maine, is the medical program. Some of the actors within that program are suspicious, almost to like a conspiracy theory level, where they think this new Office of Marijuana Policy of the state of Maine is coming after them and coming after their plan, which is most certainly not the case. So luckily I thought of this early on. If you bring it down to a human level, you can break that down. It's not going to fix it overnight, but you can start breaking that down. So I wouldn't bring in 2,500 caregivers, but they would break out into factions, and they would most certainly have unofficial leaders, and I would invite them into the office and talk to them, human being to human being, asking them about their business, their families, what their goals and hopes are. And my favorite line would be, listen, the governor could have appointed a retired 70-year-old DEA agent to run this program. She didn't. She appointed me, a policy guy, who worked for the legislature for 8 years, and before that was a comedian and bartender. Like, I think we're all in a good spot. You can trust me. So it's really building that good faith partnership, or attempting to humanize it. Because honestly, that was the #1 challenge, was just people so skeptical of what we were doing. So we just try to do it as a transparent way as possible, have those conversations. I've never turned down a meeting for anybody in this industry that's trying to do it and trying to do it the right way. That's brought its own challenges in some instances. But again, it goes back to just when you're willing to make yourself available, when you do listen, sincerely listen to them.
And so along those lines as well, I think we've talked about mitigating some of the disruptions to medical marijuana operators when you're making that transition over. So I'm curious, when you're transitioning, when you're going from and aligning a medical program with a recreational program, how can you mitigate disruptions? I'll throw that out for the panel. Kat, Sean.
It can be difficult. There are inherent, this process is constantly evolving, and as the process evolves, that evolution itself can cause disruption. Unfortunately, some of these huge changes in our licensing and regulatory structures have been referred to in the industry as extinction events. And so, for example, January 1st was considered one of the first extinction events. Just requiring a license in itself was going to cause a lot of businesses to go out of business because they just overnight weren't going to be able to get that license. Another extinction, what's referred to as an extinction event, happened in July of 2018 when the state of California phased in some of its heavier testing requirements. Many businesses just weren't able to overnight meet those testing requirements. Because again, the process is constantly changing. I think that if we could have had the foresight to know what some of those changes were, even if they were going to happen gradually, to let folks know, all right, from day one, you have 6 months to get this together, you have 18 months to get this together, you're going to have 24 months to get this other piece together. I think it would have allowed businesses to be more strategic and nimble on how they change their operations. I think also, and just to kind of go back to a previous point, many California medical operators were not happy about adult use legalization. They sometimes were the most vocal critics of legalization because they understood that or believed that this process was going to be detrimental to them. And I think creating pathways, or at least communication tools, specifically with folks that are trying to go through the transition, would have been helpful. I think that locally, the existing market that was able to transition was a little bit more calm because they knew that the local ordinance actually gave them priority. in the processing of their applications. But there were specific language that allowed us to allow for medical operators to transition. So we didn't say anybody who was engaging in medical activity before can transition. It was people who met a specific requirement in the local ordinance, and of course there was confusion, or a lot of people felt as though they deserved to be able to participate in the transition. So I think and we're still going through that transition in the city of Los Angeles. But I think that as much information again as you can provide as early as possible, so that people can just people are taking risks. And so we just want to allow people to at least make more calculated risks.
So one of the concerns we had is on disruption to patients as well when the program transfer happened, because these were folks that they had access to medicine. They were the system functioned in a way that they came to rely upon, and so the apprehension or the anxiety was really around, okay, there's a new agency that's in charge now. That means things are going to change, right? And so we kept describing it publicly as a lift and shift. It's kind of, if you like your dispensary, you can keep your dispensary. But the rationale from our standpoint was, when we introduce adult use sales, how do we also minimize disruption, knowing that our earliest operators on the adult use side would be existing now co-located medical and adult use facilities. So we actually embedded within regulation, and then also adopted some kind of guidance and additional policies. Within regulation, we require that anyone that's going to be co-located reserve 35% of their inventory for patients. And if you had sales data that dated back at least 6 months, it wasn't just 35% of your overall inventory, it was 35% of your product variety as well. So if a patient came to rely upon a certain strain or a certain product, whether it be wax, shatter, or vape cartridges, that had to be available for them. So hopefully that was an idea or an objective around your product will still be available. When I sign a commence operations notice for a facility to open up, I require 3 days notice to the public. The rationale behind that is, if patients need medicine, get there within those 3 days to avoid the lines and any other disruption that may occur as far as access to the facility. We also require separate lines where medical patients need to be prioritized within a facility, or medical patients can choose to use the adult use line. You need to service them there as well, mostly to avoid that if patients want to be afraid or nervous about a potential stigma for being a patient. They have access to the entire facility, but you also need to expedite and prioritize them. We also require, based on that stigma as well, that facilities, retail facilities that may also be co-located dispensaries, have a private patient consultation area. Again, to avoid, if they're in line and their old high school teacher or something is there, that knowing that the stigma still exists. And we want to make sure that folks, if they want to have a means or a way to avoid it, delivery is also available in Massachusetts as it pertains to medical as well. So again, trying to make sure that there's as least disruption as possible. An anecdote that I think is still telling for me is, when we took the program over, we didn't reissue new patient cards. It was more, as you renew, you'll get a new patient card that has our contact information. And a patient called the office at one point after the transition and said, "I'm terrified that you guys just sent me a new card. Can you please get rid of your return address? My landlord will kill me and probably evict me if they see that it says Cannabis Control Commission as the return address." Formerly, it was the Department of Public Health. That's a routine mailing that may not have that stigma associated with it. I totally took that for granted. That day, we changed the return address to just be our physical address. But that's the point. That was really interesting and again, telling and kind of weighed on me, as that stigma is still out there. And any opportunity you get to kind of either at least accommodate it or hopefully break it down, that alone is, I think, avoiding that disruption.
And Eric, I have a question for you around something very similar to this. I'm trying to get about 3 questions into the next question, because I have very selfishly taken all of your time, and we are coming close to the end of our time. But happy hour is a great time for Q&A as well. So if we don't get to that here, it's a nice time to have a beer with someone and chat about what's some of these things that we may not have covered. But I want to talk systems, technology, and making data-driven decisions.
Yep.
So Eric, challenges that you face in identifying the appropriate technology that allows for efficient operations and record keeping. Let's talk about how you've selected those systems or identified solutions that you're pretty confident are going to work.
I don't know if I'm the best panelist to ask this question. I mean, if you're talking about some of our IT projects. So when I came on, again, we were under a time crunch to ensure that we could roll out our adult use industry this year. I wasn't left with a lot of options. So we actually inherited like a licensing system from our medical program. Luckily, it's turned out to be a great system, a great staff, but we didn't really have a lot of options there. We got really lucky too, because they're like, oh, we can absolutely service your adult use industry. I said, okay, well, here are all our business requirements, and their jaws more or less dropped. But it's been steady progress, and it's going to actually work out really well. So that just worked out really nice. And then the current one that we're going through right now is trying to find an IT solution, a software solution for our compliance, how we're going to track our compliance activities to ensure that we have high compliance rates, to ensure that we're efficiently inspecting each program. And we're currently in the middle of that. I would imagine, being a state agency, we're going to have to go through the RFP process. But I think it's so important too, knowing when you go in there, it's so important to ask the right questions and ensure that you're scoring and grading those RFPs appropriately and putting enough weight behind the questions that are important. So kind of in short, and then you actually talked about data-based decision making. So we haven't gotten to that point yet, but we have a really cool project that we're working on in Maine. I think it might put us in the forefront as far as we're starting the development of a marijuana-specific data warehouse. We're bringing in all kinds of data points from different state agencies to better understand the health impact and the safety impact of these programs on our state. Whether just some basic examples are some DUI-specific marijuana from the Department of Public Safety. How many school expulsions will happen in these two counties in this time frame? Going across different state agencies, bringing that in. And it's actually a large project and very difficult, because a lot of the times the questions that we want answered, the data doesn't exist, so now we have to develop a gap analysis, figure out how to get that data. But in the end, the long-term goal is to be able to take all of that data and overlay it with all the data from our track and trace system and all the data from our licensing system. So when we get asked very complex questions or trying to figure out how to make our programs work better and how to ensure the safety, we're able to overlay all that data and have very informed data-driven decisions. So that's probably about a year or two out, but we've started that process, and it's kind of nerdy and kind of cool.
Yeah. Kat, you mentioned, as we were prepping for this, you mentioned the importance of data-driven policy making. Can you share an example from California, from Los Angeles, of good data-driven policy making as it relates to harmonizing or aligning those medical and adult use marijuana programs?
Yeah, so this is actually going to relate to enforcement, not licensing and regulation. The Department of Cannabis Regulation has been working very, very closely with the mayor's office and their task force that has this interagency approach to trying to deal with cannabis. And one of the things that I identified early on when I started with the city is that many city agencies just systematically weren't collaborating well together. There may be, and part of it is that the city of Los Angeles is huge. So for example, there are 21 different police divisions in the city of Los Angeles, and largely it's up to the discretion of that particular captain at that police division how they handle enforcement in their particular geographic area. And the challenge is that unlicensed cannabis activity is an issue citywide, and there really shouldn't be too much discretion as to how it's being tackled on one side of the city versus another side of the city. And so one of the things that we're working on right now is essentially building out a complaint portal that's also using a GIS system so that we can, as we get complaints that come in, identify the locations that are associated with these complaints, map out these complaints where they exist in the city, and then try and say, all right, we actually see that there is a proliferation of illegal activity happening in this particular police division. Now that we have this enforcement task force that's together, let's figure out which tool, which agency is going to be most appropriate to deal with that particular location. And let's say that we're looking at a particular police division and there are 10 unlicensed operators. And we're able to, in the complaint system, code to say that 4 of these unlicensed operators have been flagged as selling to minors. 2 of them are open late, and other ones are doing other things. Well, we want to prioritize the folks that are selling to minors. So not only are we focused on this particular geographic area, but we're prioritizing how we're choosing the enforcement tool and the just even the timing of that enforcement. And so all of this is happening in real time. We're trying to continue to collect information and to, again, use that data to inform how we take enforcement actions, because the reality is, I almost laugh at folks sometimes when they're saying, we have 30 illegal facilities in our community and we're trying to figure out how to deal with them. We could have upwards of 300 unlicensed facilities in the city, and the reality is that we're not going to be able to shut them all down immediately. So there has to be a prioritization. We have to be using our resources wisely and trying to have the greatest impact possible. And the only way that we do that is with data.
Excellent. So we are at time now. It's 4:44, and this is scheduled to wrap up at 4:45. So we are going to wrap this up. But I want to thank you all for being here today. I want to thank you for sharing your knowledge with us. As we kind of filter off the stage here, feel free to come up. I don't know if you're free to answer a few questions. I'm sure there will be questions. But I really thank you all for being here today, and I thank you for being here.